Inflammation doesn't just go away. It used to be thought that inflammation started because of some stimulus, and once that stimulus went away, the inflammation would kind of fade away. But it turns out that's not actually how it works. There are two distinct processes that are at play. One is that inflammatory process, where a stimulus prompts the body to send out signals that recruit inflammatory cells. And these inflammatory cells start the healing process known as inflammation. But something else that these inflammatory cells do is they recruit other inflammatory cells. Once that inflammation starts, it's essentially a self-perpetuating cycle. The second process is the resolution phase. And here, the body sends out different signals that tells those inflammatory cells to stop. Inflammation is incredibly helpful and necessary for the healing process, but if it isn't turned off, it's just going to start causing more unnecessary damage to the body. And when things are working well, that situation does look like that initial hypothesis, where inflammation is caused by something and then eventually just sort of fades away. But it's important to know that's not actually how it works. And in many different chronic inflammatory conditions like asthma or osteoarthritis, part of the issue is that the body is not resolving that inflammation. The resolution phase isn't turning on. And while it's definitely worthwhile to address that initial inflammatory phase, it's also extremely important to make sure that you're addressing the resolution phase. And we can talk about that more later, but as a start, if you're looking to initiate that resolution phase, then make sure you're getting at least 7 or 8 hours of sleep every night.